Dr. Ramya Raghavan. I'm an epileptologist here in Dayton, Ohio, working with Dayton Center for Neurological Disorders and Kettering Health Network. And these are 6 things that you need to know about epilepsy. First things first, epilepsy is a neurological disorder. And epilepsy is basically diagnosed by a neurologist or an epileptologist after a person experiences 2 seizures. A seizure is a sudden and temporary change in electrical and chemical activity in the brain, and it can lead to a change in person's movement, behavior, level of awareness, and feelings. Really, anybody can get epilepsy and get seizures. Typically, it's more common to see it in the really young population and really old population, but it can happen to anybody at any time. And sometimes we don't always find a cause for it. Not all seizures are the same. Sometimes they're provoked either by big fluctuations in any metabolic changes like high blood sugar, something like that. Sometimes medications can trigger seizures, or sometimes not getting enough sleep can trigger seizures as well. But epilepsy is diagnosed after a patient has 2 or more unprovoked seizures. Sometimes seizures can come from one particular part of the brain after having a structural lesion. Sometimes we just don't find the answer. But diagnosing epilepsy is kind of like a puzzle. So it involves taking a good neurohistory, an exam. So we spend a lot of time trying to get a good idea of what everybody's experiencing. And then it also involves a little bit of testing. So one of the things that we like to do is check an EEG, which is an electroencephalogram. And basically what that does is it records brain waves on the surface of the brain. Basically, there's an electricity that kind of runs over the top of the brain, and in patients with epilepsy, they will have abnormal discharges, and we can see that on the EEG. The EEG is good for looking at stuff that's going on in the surface of the brain. Sometimes it doesn't always catch when something's really, really deep in the brain. But that's where sometimes doing imaging like an MRI can kind of help us see if there's any structural lesion that could be causing the seizures. So the 4th thing is managing seizures in epilepsy requires kind of a team approach. First things first, always kind of starts with medications. There's a whole wide world of medications that are available, and every year there's something new that's coming, and kind of works on a different a different channel, and can provide, and everyone responds differently to different medications. After most people respond well to one medication, sometimes patient needs 2 or 3, but once you get to the 3rd medication is when we kind of start looking to see if patients are potentially a candidate for epilepsy surgery. Sometimes if the surgery is coming from a particular lesion or a particular spot in the brain, they might look to see if they're a candidate for a resection of that lesion. Otherwise, there's other devices that we can use, such as a vagal nerve stimulator or VNS, responsive nerve stimulator or RNS, and a deep brain stimulator or DBS. Typically, evaluation for these are done at epilepsy surgery centers, and will typically involve a stay in the epilepsy monitoring unit where we can kind of capture and characterize the seizures. And then it might involve more testing with language and memory as well. Number 5, seizures are a neurological emergency, and it can definitely be frightening to witness a seizure for the first time. So there's kind of a good approach to kind of watching and managing patients who are having seizures. Basically, make sure patients are on their side. It's important to kind of keep a timer and watch to see how long seizures are lasting. Most of the time seizures will last about 1 to 2 minutes, and then patients will be confused afterwards. But it's really important to, if the seizure's lasting longer than 5 minutes, to call an ambulance and get them over to the emergency room. It's important to have a good discussion with your doctor about having a seizure management plan in place in case you were to potentially have a seizure, having a seizure rescue medication on hand if it's common for you to have seizures that last longer than 5 minutes or having multiple clusters in a row. After having a seizure, we have strict seizure precautions. Of course, this varies state by state, but one of the biggest ones is after having a first seizure, you're at risk for having another seizure within the first 3 to 6 months. So our recommendations are typically no anything that if you were to lose consciousness could put you at risk. So the biggest thing is no driving for at least 3 to 6 months. But we also recommend no operating heavy machinery, no tub baths, no climbing ladders, anything that if you lost consciousness, you could really hurt yourself. And then number 6 is have hope. Our goal in the epilepsy community is that we can find a way to help everybody. There is new research and new things that are always coming down the line.